Good evening. Tonight, we're tackling a critical issue: the cost of healthcare for millions of Americans. For many, health insurance is only possible because of government subsidies, specifically, enhanced premium tax credits from the Affordable Care Act. These subsidies lower monthly insurance premiums, making coverage affordable for families who would otherwise be priced out. Expanded during recent years, these credits now help not just low-income, but also many middle-income families. They cap what a family pays for insurance as a percentage of income, shielding households from unpredictable premium hikes. Without this support, millions would face the impossible choice between health coverage and other essentials. But these enhanced subsidies are set to expire soon. If Congress doesn't act, families could see their insurance bills jump by hundreds or thousands of dollars overnight. This isn't a distant problem, it's a looming financial cliff for millions. The stakes are high. The health and economic security of families across the country hang in the balance. Let's look at how this crisis is colliding with another challenge in Washington. As of October 22, 2025, much of the federal government is shut down. Congress failed to pass funding bills, furloughing federal workers and disrupting essential services nationwide. Military personnel, law enforcement, and public servants are working without pay, while services for veterans and seniors are delayed. This shutdown isn't just political theater, it's hurting real people and communities. The debate over healthcare subsidies is unfolding in this tense environment. Lawmakers are using the shutdown as leverage for unrelated policy fights, putting paychecks and services at risk. Now, a group of Republican lawmakers is insisting that the urgent issue of expiring healthcare subsidies must not be ignored or used as a bargaining chip. They want action on both fronts, ending the shutdown and protecting families' health coverage. 13 Republican members of Congress have sent a direct appeal to House Speaker Mike Johnson. Their message: end the shutdown with a clean funding bill and urgently renew the Enhanced Affordable Care Act subsidies. This is notable. These lawmakers have often criticized the ACA, but now say letting subsidies expire would devastate working families. They warn that millions will face drastic premium hikes if Congress fails to act. Their letter highlights the real-world impact. Families in their districts depend on these tax credits to afford insurance. The lawmakers urge leadership to prioritize preventing this harm, regardless of broader healthcare debates. This public appeal puts new pressure on Speaker Johnson, signaling that protecting families from premium spikes is a bipartisan concern. They advocate reopening the government now, then immediately addressing the healthcare crisis. For these Republicans, the well-being of their constituents comes first. The Republican letter calls for separating the government funding fight from the healthcare debate. They argue that using the shutdown to leverage healthcare policy is counterproductive and hurts Americans. Their immediate goal: pass a clean funding bill to reopen the government and pay federal workers. Then, Congress can focus on a responsible solution for expiring subsidies. The lawmakers reject using healthcare as a political weapon, recalling past backlash when coverage was threatened. They acknowledge millions, including their own voters, rely on these subsidies. Their approach: ensure stability for families first, then debate reforms. It's a pragmatic path to avoid a spike in healthcare costs and political fallout. The stakes are personal. If subsidies expire, millions could see premiums double or triple next year. For many, that means choosing between health coverage and basic needs like food or rent. Losing insurance could lead to medical debt or delayed care, with devastating consequences. The Republican lawmakers aren't just calling for a simple extension. They want reforms to better target assistance and control costs. This opens the door for bipartisan compromise. Extend help, but make it more effective. Their message is clear. They don't want to be the party that strips healthcare from families. By separating the shutdown from the subsidy debate, they're seeking a practical solution. For millions, affordable healthcare isn't political, it's a daily reality. The question now: will Congress act before families face the fallout?